All right. Max morning. My name is Dr. Albert Sedo here. I'm privileged to be here with Chief Medical Director, Dr. Bauer in Taraba State, Nigeria. And Dr. Bauer, I just want to ask, how did you come about Celgivity and what has been your experience so far with Celgivity?
A friend introduced me to Celgivity because I had been complaining of severe back pain and had been on medications and pain relievers. And then he asked me to try Celgivity. I was skeptical from the beginning, but I thought as a science-based person I should go through the online and check. And I browsed. It has a fine scientific basis. So I decided to try Celgivity. I started with 2 bottles, and then gradually the pain started waning, and I continued taking the Celgivity. I discovered, I've been on Celgivity now for 3 months. I discovered that my pain stopped, the waist pain stopped. In addition to that, I, who have been using glasses for more than 20 years, can now read without my glasses. And I can move without my glasses. So I said, wow, that must be miraculous. So I took a step further and felt there are some challenging cases that I should try them on. And then I did. One was one of my patients who had sickle cell disease and kept having very frequent crises. She was on Celgivity, and then the crisis abated. The father testified, her mood improved. And self-confidence, she now developed self-confidence on herself. The other person was a case of glaucoma. He's had his surgery, but the sight never improved much. So I thought of sharing the story of Celgivity with him. He tried the Celgivity, and he came back to tell me he had improved. He's still on Celgivity. And the other person was a case of full-blown AIDS that had defaulted in her medication. When she was brought, she was quite moribund. In addition to her drugs, I decided she should try Celgivity. And it worked like magic. She was on her feet, continued her medication. The other is polyarthritis. And like the experience I had with my waist pain, back pain, his too. He came in and shouted, bam, Celgivity had done something for him. And I have been a hypertensive for the past, in fact, since 1993 on drugs. But now, having added my Celgivity, it became more stabilized. I'm happy, and I feel people should use Celgivity. I've encouraged my colleagues not to be skeptical. It is science-based. Look at it, try, and let your patient give you the story. So I recommend Celgivity. I have been practicing medicine for 39 years. And so I am talking from experience. That is a personal testimony, and I have a conviction. I like Max.
Thank you very much, Dr. Bao. We appreciate your full endorsement of our product, not theoretically, but practically. You've used the product, and we salute your confidence. And for those of you who are wondering, Dr. Bao doesn't just buy and sell to patients in his consulting room. What he does is he's building a team. He's recommending to friends and family. Of course, registration is free to get a product at wholesale price. So if you are interested to get a product for your mom, for your dad,